correct facial rejuvenation procedure includes the regeneration of all the tissues. We want to bring to your attention the newest skin regeneration protocol. First of all, it's necessary to stimulate the dormant stem cells' differentiation into new, young fibroblasts that can produce reticular collagen and consequently rejuvenate the skin. To boost this process, we need to use a small concentration of oxygen's free radicals, to be exact, from 0.1 to 0.5 millimoles. What we're looking for is to activate the Fenton's reaction by mixing a certain amount of ascorbic acid with trivalent iron and to obtain, like that, the optimal concentration of free radicals. It's very important to calculate the free radicals concentration correctly because the use of a smaller amount can decrease stem cells' function, while a higher one leads to stem cells' death by apoptosis. Therefore, we need to use a preparation consisting of two phases. The first one with ascorbic acid and the second one containing a physiological solution and trivalent iron. When these two phases are mixed, the necessary right amount of free radicals gets released and activates the dormant stem cells' differentiation. The drug should be injected with a 31 to 32G 4 to 6 mm needle. It has to be inserted firstly perpendicularly and then with a 45-degree angle and form a papule. The differentiation process is completed in 21 days, and as a result, we have new, young and functional fibroblasts able to restore the skin's matrix. At this point, we can pass to the next phase and activate the proliferation and the increase of the metabolic processes of the young fibroblasts by using the autologous growth factors or a synthetic analog. The drug should be injected with a 31 to 32G 4 to 6 mm needle. It has to be inserted firstly perpendicularly and then with a 45 degrees angle and form a papule. The mentioned synthetic PRP contains an optimal concentration of the growth factors such as TGF-beta1, IGF-1, as well as GABA and hyaluronic acid fragments 10 kilodaltons in size. This drug boosts the proliferation and the metabolic activity of the newly formed fibroblasts. The maximal fibroblast proliferation activity is observed between 15 and 30 days after the procedure. It's very important to regulate the dermis's physiology during this period in order to improve the regenerative processes. For this purpose, we use a drug that contains amino acids, precursors of the dermal matrix's components, cysteine, which inhibits the metalloproteinase, a bicarbonate buffer playing the role of a matrix fluidity regulator, as well as substances that slow down chrono, photo, and inflammaging, the aging resulting from inflammation. The drug should be injected with a 31 to 32G 4 to 6 mm needle. It has to be inserted firstly perpendicularly and then with a 45 degrees angle and form a papule. This protocol includes the stem cell stimulation once every 6 months, the injection of autologous or synthetic PRP after 21 days, and the stimulation of the newly formed fibroblasts by using a drug that regulates the dermal matrix's functions after 1 month. This cycle should be repeated twice a year, and to maintain the dermis's physiology, we suggest to use a drug that regulates the dermal matrix's functions once a month in between the cycles.